National Women's Health Week is underway now. It aims to empower women with knowledge and take control of their health and encourage each other. Our next guest is working with Allstate Insurance to give women diagnosed with breast cancer a place to share their own stories. We're happy to welcome New York Times bestselling author of The Silver Lining, Holly Jacobs, also a breast cancer survivor. Good morning, Holly.
Good morning, Mary. Thank you for having me today.
It's our pleasure. Would you describe this initiative and what's the goal of it?
So the initiative is all about the health, well-being, and empowerment of women. I was diagnosed with cancer when I was 39 years old. I had no family history. I was healthy, happy, vegan. So my diagnosis literally shattered my world. And as a nurse and a social worker, I found myself moving from the side of the bed as a healthcare professional into the bed as a patient. And shortly after my diagnosis, I looked for and could not find a book to help guide and support me from the time of my diagnosis throughout surgery, chemo, radiation, recovery, and then into life after cancer. And like I said, I couldn't find that book, so I wrote it with my dear friend and photographer, Elizabeth Messina. And from the time I wrote the book, I knew that I wanted to get the information into the hands of every person diagnosed with the disease. And so the initiative that Allstate and I are doing is the Silver Lining Companion Guide, and it is a condensed version of the original book that provides the practical tips, lifelines, suggestions of how to get through the breast cancer experience. And what it does is it sort of gets rid of all the clutter. I mean, there's so much information out there. It's overwhelming, confusing, at least it was for me. And so I've utilized my personal experience as a cancer patient, along with my professional experience in healthcare, to create the supportive guide that I wish I had had when I was going through it.
It's interesting you say that, working in healthcare, and yet you were overwhelmed. So to think of others who may be in other fields, what that diagnosis and being bombarded with information, what that can do. But we talk about women sharing their stories. Why do you think that's an important part of the process?
There's this funny thing that comes with a cancer diagnosis in that not really funny, but ironic, where people feel isolated. And this was the case for me. I would literally be up in the middle of the night with side effects and think, I am the only person in the entire world going through this. And those feelings of isolation, of being alone, are just scary, and it adds to the burden of being a patient. And when people come together and share their stories, it's empowering because it helps reassure people that they are not alone, that there are supportive healthcare team members, friends, family, and even people we haven't met who can support you in this process. And that's one silver lining of going through it, knowing that you're not alone.
And the title of your book, and now this companion guide, why is it important to recognize the silver lining? I mean, it's got to be hard for a lot of people to find it.
Absolutely, and the silver lining is not in that way where, oh, if you look for a silver lining, everything will be fine, because unfortunately, silver linings don't take away nausea and constipation and pain. But what silver linings do is they provide that little glimmer of hope to help give the balance and perspective to get sometimes just from one moment to the next. I mean, silver linings for me were a little hummingbird outside my window when I was literally too sick to stand. And I would just look out and there'd be a little hummingbird. That's a silver lining. And sometimes it's the little things that make a really big difference and help us manage and contend with these very real feelings that are part and parcel with a cancer diagnosis. And I talk a lot about this in the free guides, and the guides are available in both Spanish as well as in English via electronic download or at Allstate agencies around the country. More information can be found at allstate.com/silver lining.
We'll leave it there, but I do wish we had a lot more time to talk, Holly. I appreciate you sharing your story today. Thank you.
Thank you.